This is Jimmy. Jimmy is a 9-year-old boy. Currently, he doesn't feel very well. In fact, he's been finding himself feeling quite tired, dizzy, and weak. His skin color is also much paler than usual, and bruises frequently form dark spots on his body. Not only that, but he often bleeds from his nose and from his gums. What happened to him? Well, Jimmy has acute lymphocytic leukemia, which is a type of blood cancer. Today, we're going to talk a little about Jimmy's situation. First off, let's start by understanding what cancer is on a biological level. Under normal circumstances, a cell divides and generates new daughter cells through mitosis. This is essential for growth, as well as to replace the numerous cells that are continuously being removed from the body. There are, however, different mechanisms that regulate cell division and ensure that there is always a healthy and consistent amount. For example, some cells might receive a signal from certain proteins called cyclins, which control the cell cycle and essentially tell them to stop dividing. Otherwise, cells also have a program in their DNA that allows them to self-destruct if they have a defect, or if they're simply too old. This is a process called apoptosis. Now, cancer is a family of diseases that are caused by many different combinations of genetic mutations. But what all types of cancers have in common is that these mutations prevent the cells from properly regulating their cell division. This means that they, for instance, are unable to receive signals from cyclins, or that they can't go through apoptosis. Thus, these abnormal and damaged cells will multiply uncontrollably, and that can change the microenvironment of the tissue, which is harmful. Oftentimes, the overabundance of cells will form a mass and crowd out the healthy ones. This mass is called a tumor. However, in Jimmy's case, he doesn't have any tumor. Leukemia is a blood cancer, so it's sort of a special case and it doesn't quite function the same way. Instead, leukemia develops in the bone marrow. This consists of a soft, spongy tissue in the center of your bones that is responsible for producing blood cells. It contains lots of immature cells, also known as hematopoietic stem cells, that eventually differentiate. This means that as they mature, their structure and function become specialized into one of three types: erythrocytes, also known as red blood cells, leukocytes, or white blood cells, and thrombocytes, or platelets. When fully matured, these blood cells enter the bloodstream and are vital for life. For one, red blood cells carry and distribute oxygen to all the different organs in the body. White blood cells are used to fight off any infections and are fundamental to the immune system. On the other hand, platelets are essential for forming blood clots and to make sure you don't bleed out after an injury. So leukemia happens when certain abnormal hematopoietic stem cells are genetically mutated and can't stop themselves from multiplying, just like any other cancer cell. However, they also lose the capacity to develop into specialized cells. Since these cells remain immature, they don't have any use and merely take up an excessive amount of space in the bone marrow, leaving the other healthy blasts with less room for growth. Therefore, those will appear at a lesser concentration in the bloodstream. As mentioned earlier, Jimmy was feeling faint and had a paler appearance than usual because of his lack of erythrocytes, which ultimately means that his body was oxygen deprived. Other symptoms that he had were frequent bleeding and easy bruising, which are explained by the fact that he was missing platelets and had much more difficulty forming blood clots. Although all leukemias involve this dysfunctionality in the bone marrow, there are nonetheless ways to classify them. The first major distinction comes down to the line of cells that have been affected. Hematopoietic stem cells can either develop into myeloid blasts or lymphoid blasts, and these continue to mature into even more specialized cells. The myeloid line is in charge of producing most of the formed elements in the blood, such as platelets, red, and some types of white blood cells. On the other hand, the lymphoid line remains responsible for making the white blood cells that are part of the lymphatic system. In addition to that, another aspect that we have to consider in order to determine the type of leukemia has to do with the level of maturity that the hematopoietic stem cell has attained before mutating. If it happens very early in the process, the blast will look completely different from a mature cell and virtually have no function. This is known as acute leukemia. Acute leukemias are usually quite aggressive and they're associated with a rapid progression of symptoms. These cancer cells also have a short survival period. In contrast, the blast could be at a later stage of development and appear much more similar to a mature cell without functioning properly. In this case, it is called a chronic leukemia. Although chronic leukemias are characterized by a slow and gradual progression, they're more difficult to treat compared to acute leukemias due to their limited, though present functions, as well as their longer survival time. Jimmy was diagnosed with acute lymphocytic leukemia, meaning that his condition was caused by an abnormality in a precursor of a blood cell in the lymphoid line. This is the type that makes up the majority of pediatric cancer cases. When Jimmy first learned about his diagnosis, he sensed his parents exuding stress, shock, disbelief, and anger. He, however, felt more confused than anything else. He didn't really understand what his disease was and what repercussions it might have on him, which is normal for younger patients. For children, the ability to conceptualize such an illness largely depends on their developmental age. For instance, a toddler might sense pain and sickness, but they won't necessarily understand why this is happening, and definitely won't appreciate strangers poking them with needles. On the other hand, older children like Jimmy can recognize that diseases are caused by microscopic agents in the body, and that medicine is needed to get better. He was thus given a few options to treat his cancer, the primary one being chemotherapy. Delivered through pills, injections, infusion, or by direct skin contact, chemotherapy is the procedure of administering chemical drugs to destroy malignant cells and to prevent them from reproducing. They contain cytotoxic agents, meaning that they're able to kill living cells. However, one downside of it is that it not only affects malignant cells, but also any normal ones that rapidly grow and divide. Therefore, chemotherapy can unintentionally destroy cells in hair follicles, nails, the gastrointestinal tract, and it especially destroys regular hematopoietic stem cells in the bone marrow. Jimmy was thus offered another treatment to complement his chemotherapy, called bone marrow transplantation, or peripheral blood stem cell transplantation. This involves harvesting stem cells from donors and giving them to him in order to replace the ones that he lost in his bone marrow. As Jimmy went through with chemotherapy, he discovered that having such an illness is much more unpleasant than he initially thought. He began to experience physical changes like hair loss, vomiting, nausea, pain, and a loss of smell and taste. Furthermore, his weakness limited him from doing the things he enjoyed, like playing sports. All of these physical changes caused him to have a diminished self-esteem and a disrupted sense of identity, especially because he is in the middle of a developmental process where he's learning to understand his strengths and weaknesses. He is particularly sensitive to social comparison and evaluating his own performance with regard to others. His friends didn't help with his coping either. When his condition wasn't so bad, he tried playing with them, but they mostly distanced themselves away from him apprehensively, as though they were scared. This was because they had trouble understanding his condition. It didn't help when Jimmy was forced to take some time off from school and was no longer able to spend time with them. This triggered a sense of sadness and loneliness within him. All of these physical and emotional factors had an impact on his psychosocial functioning and contributed to his development of depression, anxiety, and distress. Now, since Jimmy is an only child, the only people he can look up to are his parents, but even they had their own issues. Having a child in chronic care comes with challenges as interfamilial relationships change, which can manifest due to differences in communication, family dynamics, and also because of the emergence of new roles for each member as their lifestyle has been altered. Despite being amazing parents and raising Jimmy in a nurturing environment, his parents succumbed to the shock and didn't regulate their emotions very well at first, which is understandable considering this life-changing situation. They often showed signs of stress and had frequent conflicts with each other, disrupting their familial bonds. However, this led to Jimmy becoming more and more anxious and worried. Seeing this, health professionals informed his parents that their behaviors would have a negative effect on their son's psychological well-being, and that would ultimately disbenefit his recovery. Not only that, but Jimmy would have an increased chance of developing PTSD from his experience in the future. Therefore, it is highly encouraged for his parents to approach the case with courage, sensitivity, and honesty. Jimmy will then be able to learn from them and have a better sense of resilience. To ensure that the child gets the best quality of life, it's important to invite Jimmy to openly communicate his feelings and talk about his thoughts. Those around him must let him know that being overwhelmed with emotions, fear, and hopes is normal. Again, children at this age might not fully understand their illness, so clearing this confusion is crucial and can perhaps be effectively done through play therapy and games. Jimmy is merely one of thousands of children diagnosed with leukemia in North America, let alone the whole world. Fortunately, survival rates for pediatric cancers are fairly high. Leukemia can be scary, but most importantly, we must stay strong.